Hi, my name is Crystal Barshaki.
Hi, my name is Kelsey Smith.
We're both occupational therapists here at Therapy Playground. We both treat many kids with sensory process disorder or dysfunction or deficits. And we've realized that a lot of our kids or parents don't even know what sensory processing is, or they know very, very little. So today we created this podcast for you to hopefully get you some insight into what sensory processing disorder or dysfunction is. So we're going to answer a couple questions. All right, our first question that we'd like to answer for you is sensory processing disorder a diagnosis? And the answer to that is actually confusing. It is yes and no. It used to be a diagnosis for everyone, and you could get it formally diagnosed by a psychologist. However, now only ages 0 to 3 can be formally diagnosed, so you can no longer get the formal diagnosis. So you could have gotten it in the past, but now there's not a formal diagnosis for it. The second question is that many people will ask, because there isn't a formal diagnosis anymore, is can my child still be treated without a formal diagnosis? And the answer is yes. So what you would do is you would come to an occupational therapy eval, and you would be evaluated by an occupational therapist, and they would do a client or caregiver survey, which through a measure on the computer or a profile and through clinical observations to make sure or to see what is going on with your child, if they're having any difficulties or deficits with sensory processing, and from there we would be able to treat your child. And typically the phrasing then would be sensory processing dysfunction or sensory processing deficits.
So sensory processing, what is it? Sensory processing disorder exists when sensory signals are either not detected or they do not get organized to elicit an appropriate response. Crystal is going to go into more further detail to tell us how sensory processing affects the body.
All right, so how does sensory processing affect the body? So when you're thinking of sensory processing, you think of your senses, right? How the input goes into your body. If you touch something, you feel it. So what we're going to do is talk about our 5 senses that everyone typically knows about, and we're also going to address 2 more that isn't typically talked about. All right, so the first one that we're going to talk about today is auditory. When you think of auditory, typically you think of hearing, listening, and that's true. It goes into a lot of aspects or concepts with that, and typically with a child with auditory, they may have auditory defensiveness, like crowded spaces, they can't really focus because it's so loud. Or maybe they are very, very distressed when they hear harsh sounds or typical sounds like a lawnmower or a dishwasher. It really bothers them. They're unable to concentrate. Or they don't hear really large or really like a fire alarm going off. They don't even notice it. That's also a sign of sensory processing. All right, so that's auditory. The next one is taste or oral. When you think of your mouth, you think of like, oh, all the different tastes, sour, sweet, and that's true. There's also goes into the fact of how much can you feel in your mouth. Maybe is there a lot of food? Sometimes they'll overstuff their mouth with food because they can't feel what's in it. It could be that they lick random objects, or they really, really like intense flavors, like a lot of salt, or a lot of sweetness, or they like to suck on lemons or limes. So that's auditory and oral or mouth. The next one is olfactory or smell. And with this, it could be that they're very, very sensitive to a lot of smells that we as typically don't notice. Or it could be that the smell of something like boiled eggs, they wouldn't even be able to be in the room. It's way too strong for them. And this happens a lot with food. If something has a strong smell, they just don't even want to eat it because it's so strong. So that's auditory, oral, and your olfactory. The next one is your vision. When you think of vision, it's seeing things, which is true, and it also could be that the spaces are really, really crowded, so they can't really focus because there's so much going on and they need to look all around. Also, it could be bright lights really bother them and they prefer dim lighting, or maybe they really like the bright lights. It really keeps them alert and aroused. Or they like to watch objects spin or different things move, like they like watching fish tanks or really bright colors. So after that's vision, auditory, olfactory, hearing, and now we're going to go on to our touch or tactile. When you think of that, you think of just the way things feel. And this we notice a lot. You'll see this a lot with kids talking about clothes textures. They don't really like the seams in their clothes, or tags or zippers, how they're cold. It could be the temperature of items, the temperature of food even. because your mouth is lined with skin, so it also goes in with that whole tactile system. Another one could be they don't like certain textures, they don't like getting wet or dirty, they become very, very distressed about it. Or they really like soft objects, they touch everything in the store. So those are your 5 typical senses that everyone knows about. Now we're going to go on to proprioception and vestibular. When you think of proprioception, it's your body and your concept of it. So it's discriminating your right from your left, so knowing the difference between the two. It also is body awareness. It's a lot of times these kids are described as clumsy. We come in and they're like, my kid is just so clumsy. And that typically is a proprioception deficit. Or they crash into items. They like move a lot and they're just constantly falling or doing something to get that input into their muscles and their joints because they just don't have it. Or they're just hanging out and they're very low because they need the input to get going, to become alert. And the last one we're going to talk about is vestibular, and that's your body's postural responses, sitting up nice and straight against gravity. So gravity pulls you to the ground and your body has to resist it, and that's vestibular. So a lot of these kids will be in constant motion. They like to jump, they like to spin, they want to move a whole bunch. And that's vestibular. Proprioception, those are the 2 ones that you typically don't hear about, and a lot of kids really do seek that movement opportunity from those. Now Kelsey's going to give you a demonstration because it's very, very confusing with all of these terminologies.
So, our sensory system works as follows. You detect a sensory stimulus, so it could be an auditory stimulus, a visual, olfactory, tactile, or oral, or vestibular proprioception. And what it does is our brain or sensory system will process the response, organize the response, and then understand the response in order for our body to elicit a response. What we typically want to see is an appropriate response elicited, but for kids who struggle with sensory issues, they usually don't organize and understand the sensory stimulus as it gets processed. So they don't elicit appropriate responses.
What Kelsey means by an appropriate response is if I get hit, I realize that's an input. And I'm like, ooh, okay, that hurt, but I'm not going to yell. Maybe Kelsey didn't mean to hit me. But sometimes kids will be like, ow, you shouldn't have touched me. Why did you touch me? They become so distressed. That's an inappropriate response. Even after multiple times cueing them, they just can't even function. They become so overwhelmed by that one input that they can't focus anymore.
Another one would be if there was a loud noise all of a sudden, the kid might cover their ears and they might start screaming and be like, what happened, what happened, what happened? Or start freaking out because their sensory system is unable to process it into an appropriate response, which would normally just be, you jump a little bit and you're scared, but then you go about your business. So my visual is going to be simulated in a traffic jam. So this is going to be our demonstration of how your sensory system works. So the first demonstration is going to be about a normal person who can respond to a sensory stimulus in an appropriate fashion. So let's say you're going to a movie premiere and you walk into the movie theater and it's crowded and it takes you by surprise, but that sensory stimulus is able to be understood and organized in appropriate fashion, so the traffic moves smoothly and you elicit an appropriate response. As you're walking through the crowded space of a movie theater, you might get bumped into 2 or 3 times, and that might take you by surprise, but you're able to respond to that sensory stimulus and organize it, and you keep going. So the next thing, you're going to walk into the movie theater and you hear the crunching of the popcorn, the opening of the candy bags, the previews that are on the movie screen, people talking. So it's a lot to take in, but your sensory system is able to organize each of those senses appropriately, and the traffic is able to keep moving in a smooth manner, and you're able to elicit an appropriate response. Well, the movie starts playing, so the lights get dim, and the screen gets super bright, and the music and the previews get super loud. Again, that's all different types of sensory stimulus, but your body is able to organize it in an appropriate way, and you're able to sit and enjoy the movie. So the next example is going to be of a child or an adolescent who might struggle with sensory processing disorder or dysfunction. So they walk into the movie theater and they see that it's crowded. Well, as they're walking in, they take in that sensory stimuli and they are unable to process it in an organized fashion. So what it does is it causes a traffic jam. Their body isn't able to respond to it appropriately, so it just sits there. The next thing, they might get bumped into by a couple of people. Well, to somebody who's able to respond to that appropriately, it wouldn't faze them. But this person, it causes them to, again, have a traffic jam. They're unable to organize that response in an appropriate way, so it builds up and it stays in their sensory system. The next thing, they walk into the movie theater and they see that everybody is on their cell phones and they're talking and they're crunching on their popcorn, they're sipping on their pop, and they're eating their candy. Well, all those sensory stimuli, their sensory processing is not able to elicit an appropriate response. So it gets stuck in that traffic jam. Well, the movie starts to play, the lights get dim, and the music gets super loud. Again, all those sensory stimuli coming in, but they aren't able to get organized. So what it causes is this buildup of sensory information that their body doesn't know how to deal with properly. And what it will cause is what we say is a sensory overload, which causes them to break down and almost have a temper tantrum and looking anxious, and they just don't know how to respond to these sensory stimuli appropriately, so they are unable to sit and watch the movie and enjoy the experience. So this was our demonstration of sensory processing disorder and dysfunction. I hope this really helped you guys better understand what sensory processing is. If you think that your child might benefit from an occupational therapy evaluation, you're more than welcome to get a referral from your doctor and come see us here at Therapy Playground. We'd be happy to do an evaluation on your child. If you would like further information, please visit the website that is going to be linked below on this video. And I hope you guys have a great day.
Thank you.